Good afternoon, everyone. Thanks for tuning in today. My name is Jeff McKay from Bright Squid. We're going to talk about clinic optimization tips. With us today, luckily, is Systemic Healthcare Solutions. The team from there is going to take us through some important tips on clinic management, clinic optimization to make sure that you're running smoothly to help with all of the things that we know are good, like improving patient access and outcomes and that sort of thing. I'll turn things over to Marie here to take us through the first few slides and talk about some of the things that they do with clinics and how they can help.
Thanks, Jeff, and thank you for joining us today for the Clinic Operations Optimization presentation. Just a quick review of Systemic Healthcare Solutions and what we do. We have over 58 years of combined experience. Our team has experience working front lines up to executive director level. We've helped over 13,000 physicians across Canada, guiding them on practice management issues. We have provided practice management advice to all specialties and sizes of clinics and offer flexible, customized, and cost-saving solutions. Our goal is to improve the delivery of patient care clinics to the best that they can be. Now I'd like to introduce you to our incredible team. Heather Vogan is our digital health and tech consultant. Lauren DiNapoli is our billing optimization consultant, and myself, Marie Corniello. I started this company years ago, and I'm so honored to have the opportunity to help so many clinics across Canada over the years. Finally, I'd just like to reiterate, all three of us have worked in medical clinics and have firsthand experience assisting patients, supporting physicians, and managing medical clinics. So that sets us apart from other consulting companies. We know what you go through on a daily basis. It's busy, it's stressful, but it's definitely rewarding. Here's an outline of the services that we offer. We can provide hourly advisory services to cover topics such as general operations, efficiency techniques, and optimization of tech and billing guidance. We offer digital tools that are downloadable from our website and can provide guidance for new clinic startups. We conduct operation reviews, which offer a more in-depth analysis of your clinic. This service is more or less like a full office checkup. And we can also focus specifically on certain areas of workflow within your clinic. The bottom line is that we can provide you with bespoke services you require rather than a basket of services you may not need. So let's start off our optimization presentation with reviewing some basics. You're likely attending this seminar, or webinar rather, because you know your clinic has some operational challenges. So let's go through some steps that you can do on your own. Step one is to establish a working group. For example, a great balanced working group may include the clinic manager, a medical office assistant, a nurse, and a physician or two. This helps to reinforce buy-in on all levels and build solutions that work for the entire team. Try to make sure the working group is invested and able to dedicate enough time to work on solutions. That's the biggest challenge. Make a list of all your pain points to take a deeper dive into what some of your operational issues are. For example, we can't keep up with the number of patient calls, or no-show rates are excessive. Next step is to gather data in the current state. Then nail down your preferred future state. For example, we want to reduce our no-shows by 50%. Then figure out some strategies to meet your goal. When implementing that new process, you want to make sure that you are utilizing all technology available to you in your budget. If you don't have time to dedicate to a formal working group, or you don't know what strategies to implement, we can help you through those steps. Good communication in any business is critical. Communication problems are the #1 source of inefficiencies in clinics that we visit. Do you receive the same questions over and over again from patients? Do you have patients complaining they can't get through on the phone? If patients are coming to the clinic to book an appointment in person because they can't get through on the phone, you've got a problem. Continuous quality improvement is important. Analyze the types of calls and inquiries you're receiving on a daily basis. Dedicate time to work through those issues. You can alleviate these inquiries with the introduction and investment into new email software solution. Do you have policies established that maybe aren't working anymore? For example, Some clinics have a policy whereby those patients with zero repeats must book an in-person appointment. This might make sense from a clinical and billing perspective, but ultimately, is it a good strategy for all medications? Consider revising your policy so that it applies to just certain medications. One inefficiency we see in clinics is the constant need for staff to get clarification from the physician. To reduce or eliminate the interruptions, procedures should be documented in a clear manner so that staff don't always need clarification. Get to the bottom of why these questions require clarification. Here's our basic recommendation. Make sure you have a human resource staff policy manual and also an office policy and procedure manual. These are both evergreen documents that management needs to ensure are updated and circulated to staff when there are changes. Other areas to focus on. Do you have clear expectations of staff with regard to performance when they first start their employment with you? If you decide to change a process during a meeting, is the process change relayed to staff? Is it documented? Often we encounter group practices where Dr. X and Y want to process a certain way, but doctors LMNOP want it another way. From a process flow point of view, it doesn't always work. In group practices with multiple policies and procedures, staff have to ask themselves constantly, okay, who does this patient belong to? And what am I supposed to say? Small variations in policies and procedures end up slowing down effective and efficient decision making. Clinics are better off trying to maintain consistent office policies and procedures, clearer messaging for staff and patients, avoid confusion all around. So, handing it over to Heather to review access.
Thanks, Marie. Do you feel like patients all wait until the same time to call your clinic? What if the front staff could deal with appointment requests and cancellations at their own pace instead? Integrated solutions like online appointment booking can improve administrative capacity, increase patient access, and decrease no-show rates. But what we find is that most clinics are hesitant to adopt an online appointment booking solution or secure messaging solution due to fear of the unknown. We review clinics' current systems and make recommendations based on what we've learned firsthand from implementing tech solutions in clinic settings. We can help you maximize clinicians' billing by decreasing no-show and last-minute cancellation rates. To accomplish this, a few of the things we would review are, does your clinic have a policy for no-shows or last-minute cancellations? If so, is that policy clearly communicated to your patients in your new patient intake packages, set up as a screensaver on the computers in your exam rooms, or available on your website? Are you leveraging online solutions like secure messaging or online appointment booking to become more accessible to patients at different times of the day, outside of the hours of 9 to 5 when your patients are also at work? Are you currently leveraging a digital solution to provide auto-generated appointment reminders? Do you have an electronic waiting list to help with last-minute cancellations? Is there a fee enforced for patients for no-shows or last-minute cancellations? We can also help clinics understand and stay up to date on provincial funding opportunities that are available for implementing digital solutions. For example, did you know that funding is currently available for implementation of online appointment booking for clinicians who are part of an Ontario health team, or for those who are currently in development to become an OHT? Phones is another topic we can help clinics with. One of the most consistent complaints we hear from our clients is about the high volumes of phone calls. Patients complain when they can't get through, and staff feel like they spend all of their time on the phones, leaving them little or no time to focus on other tasks. We provide workflow analysis assessments, and we make practical recommendations to enhance your clinic's efficiency and reduce the burden on administrative staff by leveraging existing digital tools. A few other things we can consider during a systems analysis would be, are you up to date on the current CPSO guidelines for accepting and responding to voicemails? Are your staff still making reminder phone calls to patients for their appointments? Are you leveraging your phone system? Are your staff easily able to make changes to your phone system from a remote location? And more importantly, are you currently able to pull statistics from your phone system to help you make data-informed decisions about your staffing? Are you communicating with patients about when is best or not best to call the clinic based on your phone call volumes? And now on to faxes. Let's take a moment to look at how information currently comes into and exits your clinic. Are you still sending or receiving faxes in a paper format? Here we have a visual representation of the process for a prescription renewal request handled via paper fax versus electronic fax systems. Notice that you remove half of the steps in this process when you use an electronic system. Not only is there substantial time savings in the electronic process, but also a significant cost savings on office supplies like paper, toner, ink, and shredding services. Really take a moment to think about how your clinic is currently handling processes like these. Your goal should be to have data entering and exiting your clinic electronically whenever possible. We can review your current workflows and make recommendations to help you reduce the number of steps each task takes. And back over to Marie to review staffing.
Thanks, Heather. When clinics encounter staff turnover, they don't run at full capacity, ultimately slowing down the day. It takes months to train up a new employee, and stats show that it costs businesses approximately $5,000 to $7,000 in total to train a new team member. So how can we retain good staff? Make sure you have an easy to follow training and orientation process. For example, covering everything from where to put their lunch to IPAC core competency training and the location of safety data sheets. As I mentioned earlier, for those that are struggling at early stages of employment, are you making your expectations clear to ensure their performance improves? Also, make sure to schedule follow-up check-in meetings. Usually we recommend halfway through probation and at the end of probation, unless there's performance issues you want to monitor. Ensure you're paying competitive rates, but as you know, it's not always about compensation. If an employee is competent, empower them and try not to micromanage them. Allow them to grow and excel. For example, when you have one-on-ones with your staff, ask them what their career goals are. Are you giving them opportunities to work on projects that interest and challenge them? If you aren't, they may look for other opportunities somewhere else, and turnover cycle will continue. So I can't stress it enough, written human resource policies and procedures need to be up to date and clear. This helps mitigate risk and gives employees clear expectations. Passing it back to Heather to focus on website and EMR optimization.
So if someone were to look for your clinic online right now, how easy would it be for them to find you? Do you have a website? Have you registered your business on Google? Are you using any social media platforms? Many people turn to social media these days for simple contact information like an address, phone number, your clinic hours, sometimes even basic clinic policies. You don't need to hire a content creator to provide visibility to your patients in the social media world. Many folks, again, are hesitant to set up social media for clinic settings, but if you do a few preventative things like turning off commenting or including a terms of use and privacy disclaimer, you can instantly become so much more accessible to a wider client base. Increasing your online presence can assist with reducing number of phone calls or with attracting new patients if that's your goal. Opting your EMR is another way to enhance the efficiency in your practice. Many EMRs offer the ability to build your own templates or tap into a library of pre-built templates. We can help you look at ways that can save time and increase accuracy by learning how to leverage the tools that are available within your EMR. A few examples: templates for patient encounters, referral letters, and consult notes, using things like custom forms, e-messages, and ensuring you're connected to the right provincial products and services. We also offer change management support and strategies for how to encourage data standardization within clinics, resulting in better quality data to work with. We also offer checklists that you can purchase and download from our website for those who want more of a do-it-yourself approach. Passing it over now to our billing expert, Lauren, for some tips on billing and optimization.
Thanks, Heather. When I first started working in a medical office, I was amazed to learn that physicians don't receive any formal billing training in medical school. And my reaction was, but then how do you get paid? The schedule of benefits technically provides most of the information you need for all things billing, but it's difficult to understand and can be time-consuming to navigate. Most doctors learn the basics of billing everyday run-of-the-mill visits, but are unsure of how to bill things outside the norm, or are even unaware of all the billable services and special premiums and bonuses that they can bill. At Systemic, we can provide you with tips and tricks around billing optimization to help ensure that you make the most of your billings. When you bill things incorrectly, you receive error reports. Make sure that you're going through these to correct and resubmit them. You are entitled to be paid for the services that you provide. But if you're not familiar with the rules for how certain codes can be billed, then the bills will be rejected. Usually, even if you can't bill what you thought you could, there will still be something that can be billed so that you don't lose out on that visit entirely. Sometimes bills are rejected due to rules around how many services can be billed in a year. For example, the diabetic K030 assessment is allowed 4 times per 365 days. If you bill it a 5th time, it will be rejected, saying that the max number of services has been reached. You could then resubmit it as an A007 intermediate assessment with the diabetic diagnostic code. Likewise, make sure you go through your monthly reconciliation advice files, because you may find bills that weren't paid due to various errors that can then be resubmitted as something else. When you are billing a visit, do you make sure to bill the codes that will be the most lucrative for the situation? For example, when doing an annual health exam, the standard code is a K131 or the K132. The other option would be to bill the A003 general assessment. If a patient has a health concern that's addressed during the exam, you could bill the A003 with that diagnostic code instead of the K131 with the standard 917 annual health exam diagnostic code. So that would be more lucrative for you. There are other K codes that exist for specific issues, like the K037, which is a code for fibromyalgia. For those of you that are in family health organizations or family health networks, this code is outside the basket, which means that you get the full amount of it rather than the 15% shadow billing fee that you would get for an A007, K005, or A003. It's a time-based code though, so make sure that you only bill it if you spent 20 or more minutes with the patient. Also remember that when you're billing time-based codes, if you spend 45 minutes or more with the patient, you can then bill 2 services, which is double the fee. So just make sure that you note the time in and out in the visit note. There are also various add-on codes to remember, such as the E080, which you can add to your visit fee if you see the patient within 2 weeks of hospital discharge, and that's worth an additional $25. When you provide care outside of the office setting, there are also special premiums that you can bill, such as home visits for the frail, elderly, or housebound, as well as death pronouncements, visits to patients in long-term care homes, visits to patients that are currently inpatients in hospital, and palliative care visits. These special premium fee codes are in addition to your regular visit fees, and they vary based on the time of day or night. For those of you who work in primary enrollment models like Family Health Organization, Family Health Network, or Family Health Group, there are lots of different bonuses that you can earn, such as the K050 congestive heart failure management fee, which is $125 per patient per year. Then there are add-on fee codes that you can add to your fee visits, such as infant care Q014 or 15. There are also smoking cessation add-on codes that you can have. So when you see a patient and talk to them about smoking cessation for the first time in any other type of visit, you bill the add-on code E079. And then after that, at 2 subsequent visits in the year, you can bill the Q042, which adds an extra $7.50 to that visit. There's also the serious mental illness premium, Q020 or Q021 for bipolar and schizophrenic patients. You bill this tracking code when you see a patient with this diagnosis, and then you can get $1,000 or $2,000 annually when you see 5 or 10 of those patients, respectively. Likewise, when you meet certain service thresholds, you get bonuses that range from $1,000 up to $8,000 for things like home visits, palliative care services, and prenatal visits. These are automatically tracked by the Ministry of Health based on certain fee codes that are being billed, but if you pay attention to your service levels by watching your remittance advice file every month, you can make sure that you don't miss out on one of these if it's just a matter of scheduling a few extra visits to meet the requirements. And then when thinking about third-party billing, do you have a system in place to ensure that you're paid for all of the forms or non-OHIP funded services you provide? One way to help with this is to make sure that you have a way for patients to pay you outside of the standard cash or check only model, because these days the people carrying cash and checks with them, those days are numbered. Also, have you checked your fees against the current OMA guidelines lately? They just released their newest update in January 2023, so you may be able to increase fees for forms and notes, etc. When you have questions about billing, sometimes the only place to turn is the Ministry of Health Help Desk, which isn't always all that helpful. At Systemic, we can offer bespoke billing optimization consultations where I can take an in-depth look at your billing practice to offer tips and guidance. If you don't need a total overhaul but just have a few questions, we also offer hourly consulting. We can also provide billing training to new staff as well as to physicians who are new grads or just new to billing in Ontario. Now I'll pass it back over to Marie.
Thanks, Lauren. Just to wrap it up here, many clinics aren't sure where to turn to for help on practice management issues. And at Systemic Healthcare, we have an Ask Us Anything open door policy. So we're here to help you navigate tricky practice management issues. So feel free to reach out to our team with any questions you might have. And if we can't help, we are confident we can connect you with somebody who can. And feel free to check out our website and downloadable resources and connect with us if you're looking for help in any way. Finally, don't forget to follow us on social media. Thanks for spending the time with us today. Passing it over to Jeff.
Great, thank you for that. Thanks for the detailed presentation. Very useful information in there, and hopefully everybody learned a bunch of stuff. I know I did. So thank you so much for that. We're going to talk about secure mail use cases for clinic optimization. Really, some of the things we talk about, I mean, a ton of overlap. And one of the reasons why we like Systemic so much is the approach that they take with, as Marie said at the beginning, really bespoke solutions. What do you want to do? What do you need to do? And how do we address that? When we work with clinics, when we work with thousands of clinics across Canada, a lot of times what we hear is we don't have time for this. We don't have time to optimize how we work. We just need to keep working. Using SecureMail, we've reallocated staff time. So, some of the things we're talking about with helping staff be more interested, more rewarded for the work they're doing. We've increased staff retention. We get rid of mail costs. We eliminate dead end phone calls, those things that kind of drive everybody nuts. And we've actually reduced phone traffic by 30% in clinics, while also reducing the average length of a phone call by 45 seconds, which doesn't sound like a lot, but if you sit there quietly for 45 seconds, it's actually kind of nice. And it gets a bit awkward if you're in a room full of people. I'm not going to do it today. Also, what happens is we engage patients as prepared participants in their care. So a lot of times that's the feedback we get, is that we would like our patients to actually step up and carry some weight when they can, because we know that's a benefit. We know that engaged patients are better for patients and they're better for clinics. So we'll talk about how that works. The challenges that we know we all face are increased patient demand for care. People are getting older. We're experiencing more need. Physicians are tired and burnt out, and there's other things they want to do. So they're not always just practicing in clinic. They're looking to find other ways to exert their expertise or other things that they want to do with their life. And we see fragmentation because those two items clash and patients go find somewhere else. If they call your clinic and they can't get through, they might just log on to Maple or Libino Health or something, depending on what their employer provides for other access points. And then we end up with a fragmented patient record. Not everybody knows everything, and it's really tough for continuity at that point. A lot of what we see, and Marie and Heather and Lauren pointed out, a lot of unnecessary administrative burden. There are so many tools available to clinics these days that can help with administrative burden. A lot of the front office stuff can be done differently and more efficiently. And what we've seen in working with thousands of clinics, different associations across the country and through the US, is that there aren't a lot of active resources that help clinics and clinic managers and physicians find ways to achieve these operational efficiencies. And so a lot of times it's ignored because we just need to get the job done. The big thing that we hear a lot is, yeah, but is it compliant? And we heard about that question before. Fax and mail misdelivery accounts for a lot of the privacy breaches in healthcare. We're mailing things to the wrong person. We're emailing things to the wrong person if we're doing that. We're faxing to the wrong number a lot. Mail is subject to opening by someone else. We don't know if it went to the wrong person until the patient calls and says, hey, I didn't get that thing you were going to mail me. And then we don't know where it went and we don't know what to do about it. There's not much we can do. So the things we're doing already and kind of accepting as compliant because that's the way we've operated and been told that sort of, we just keep doing that. So there's a lot of different considerations in healthcare and how we're operating already about what's compliant. We do see fax changing things quite a bit. People have come to terms with the fact that fax isn't very good in lots of ways for lots of reasons. I think the Ford government announced last week that we're going to try and phase out fax over the next little while, and we'll see how that goes. But hopefully it does go that way, because it does raise quite a bit of issues, not just in privacy breaches, but also functionally in terms of how we're operating. It takes up a lot of time, it takes up a lot of resources. When we talk to clinics, when we work with clinics and go in and say, hey, let's see how we can help you run more efficiently, and if talking with Systemic, a lot of these things align with their experience as well. And you might not nod your head at all of these, but I'm guessing you're going to nod your head at a bunch of them. And I'm not going to go through all of them, but requiring in-person visits when virtual ones are okay, and that takes less staff time to clean rooms and move stuff around. Physicians collecting all data in an encounter. We have physicians that have cut their encounter time in half just by collecting information in advance of appointment. Hey, the doctor would like you to answer some questions about your upcoming appointment. They've got the first bunch of questions answered, but as they go into meet with the patient's more focused, the physician's more focused, and we get to a conclusion more quickly. Phone calls, sending out paper, printing stuff, scanning stuff back into an EMR that was digital and then put on paper so they could be transmitted somehow and then put back digital again. That's a huge waste of time and resources that we can get around. One thing I like to mention is it comes back to our inability to really get our heads up to take a breath, to know that what we're doing isn't the best way to do it, or find other ways to do things. And it's no one's fault. We're too busy. We need to find ways to get less busy. And we did a webinar with one of the physicians we know and the CMA a couple of years ago about how bad faxing is. And I was in the clinic the next day, and one of the staff said, hey, did you hear that podcast about faxing? I said, yeah, isn't that interesting? And she said, I had no idea fax is so wasteful and bad, and I'm the one who does all the faxing, right? So then that's when the faxing stuff changed in their clinic. What we know from research is that repetitive tasks, doing the same thing over and over again, like dead-end phone calls for appointment reminders, stuffing envelopes for lab recs that we're mailing out, or anything else like that, faxing and refaxing documents that didn't go through. If you do a cheek swab on someone when they're doing those jobs, the physical markers of stress will be elevated. So all those kinds of things, retyping things that I just typed again, all that stuff impacts staff satisfaction, which has other effects as well, because it actually turns out that one of the good things for physician satisfaction is to have satisfied, reliable, productive staff supporting them. When we look at how virtual care works and how secure email works, we don't always say secure email is for virtual care, and it certainly isn't. There's lots more that it does. What research shows is that globally, it's pretty close. This data here is from Kaiser Permanente. They looked at 36 million different virtual care interactions, and they saw that 83% of them were text-based. They're sending secure messages through a secure mail system or through a patient portal. 17% were on the phone, and less than half of 1% were video. Video is just tough. It's a tough technology to get aligned with patients. It can be expensive, and it can be cumbersome. We do know that through virtual care with secure messaging, you can see a 44% improvement in patient satisfaction. We can see that providers report higher overall averages of visits per day. So that's great for those access numbers, for your attachment, for your continuity of care with patients. Imagine if clinics across Canada and across Ontario were able to improve their average visits a day by 11%. We would have a great increase in access, and we might limit some of those issues that we're starting to see. We do know that in secure mail usage can increase provider satisfaction. We know that 42% of patients say they don't leave with all the information they need, and as much as 80% of the information that patients receive in an appointment is forgotten by the time they're driving out of the parking lot. So there's lots of room there to help with the information exchange. When we look at secure mail and we ask clinic managers, what are you using secure mail for? Predominantly, they're replacing email, mail, and fax. That's obvious. Not many people were using email to start with. A lot of clinics that were using email for benign, non-patient related or non-treatment related communication use secure mail instead because we block ransomware. It's more private. It's just safer for their network, that sort of thing. And we can see in the middle column, that's clinics sending over 100 messages a month. So sort of high-ish users. There's a lot more phone usage is the big indicator. So the clinics that are more optimized, more efficient, more effective are finding other ways to do things. And those phone is, we're replacing reminder calls. We're giving patients the ability to message us in the evenings or during lunch hour when maybe we're taking a break from the phones, so that they're not getting that frustration of I can't get through. They don't have to wait for, sometimes we've timed voicemail messages when you call into a clinic to be 3 minutes long before you're given a chance to press a button to talk to somebody. That breeds a lot of animosity in patients, and we've seen it happen at different clinics. Patients really do actually like secure messaging, obtaining results, if I have a question about a medication or something, and to give follow-up on treatment. Phone and office visits are pretty low in preference there. You can see that patients are quite happy using secure messaging. One of the questions we get a lot is, aren't patients just going to bury me in messages? And that's absolutely not the case. This research shows that clinics can expect about 5 to 6 messages a day inbound from patients. We have never had a clinic say they have gotten too many messages from patients. And the statistics from the number of patients on our network, which is almost 400,000 patients with a secure mail account versus, Alberta, for example, there's 9,000 healthcare professionals with secure mail and almost 100,000 messages exchanged in the province. Most of those messages come from that 9,000 healthcare professionals. Just a quick note, secure mail is verified as compliant for virtual visits in Ontario by Ontario Health. You can check that out on the otn.ca to find more about that if you're looking for a solution there. When we talk about optimization, templates is something that we introduced a couple of years ago because talking to clinics, they said that a lot of what we do is standardized and repetitive. We send this message again and again and again. And so you can now save a message. It'll be personalized to go out to whoever you're sending it to. It'll put their name in, it'll put your name in as the sender. But all you have to do is select the template, put in the email address of the patient to address it, and click send, and there you go. That can include attachments. What we've heard from clinics is we actually save 2 to 3 minutes of typing with every send. So clinics sending 100 or more, you can see how that adds up pretty quickly. When we apply that to the number of templates that have been sent and the number of clinics have saved over 2 weeks, over 2 working weeks of typing just by using templates. So when we talk about reallocating staff time to more valuable, more productive, more rewarding tasks, what could be better than helping them not type so much and take 2 weeks of their life back and put it to more productive tasks? When we look at what people are putting in their templates, it's really interesting. So we can look at template content because it's not associated with a patient before it's sent. So we categorize them. We know that 2/3 of clinics using templates are sending follow-up templates. So in your last appointment, we talked about this, or here's some helpful resources about your new diagnosis. Here's some tools for tracking your eating habits, journaling about sleep. We see all that kind of stuff because attachments can be already saved in the template and ready to go. Same with any kind of hyperlinks to YouTube videos that might be helpful or other resources related to a patient's condition that you wouldn't want to email because at that point you're indicating something about their health, and that's considered protected information. We also see instructions. Here's what to do now. Maybe here's what we talked about. You should be doing this stuff. Please continue with that for treatment adherence. 40% of template sends are pre-appointment. Appointment reminders, instructions, policy updates. You're coming in for an appointment tomorrow. We require masks. Please don't bring your kids. If you need to park, here's where you park. All that kind of stuff can be included in that as an attachment. All the stuff you might put in your phone tree. We can collect information. So please, like I said, please fill out this form. Maybe it's a patient intake form. Maybe it's a condition-related questionnaire. They're coming in for migraines, and the doctor would like to know a little bit about what triggers them or how frequently they have them before going into the appointment. Document sending, so here's your records, here's a copy of your latest x-ray, maybe. Here's a lab rec we would like you to do. Here's your results, or here's the doctor's note you requested. We help reduce mail, so we don't have to mail stuff out. Clinics save hundreds, and some clinics have told me they save thousands of dollars by not mailing things anymore, because they're not printing, they're not buying stamps, they're not paying staff to sit there and fold paper and stuff it in envelopes. We see information just getting sent. Here's some condition related stuff. Here's some seasonal information. I know of a couple clinics that just have things that go out to patients or parents and say, here's how to treat your kid at home for respiratory or flu symptoms during the fall. Notices such as we're changing our hours, we offer new services, we welcome a new physician, we're moving, that sort of thing. We've talked to clinics who have spent as much as $3,500 mailing all of their patients a notice, and they could have done it for $10 using Secure Mail. So we'll talk a little bit about that in a couple minutes here. And also referrals. So Secure Mail can be used with anyone. You can invite anyone to use it. We do know there's a healthcare region around in the southwest Ontario, around London, that uses Secure Mail because the school system in that region actually already canceled fax. They got rid of faxes a couple of years ago, and now they couldn't use the way they were used to communicate with the schools, with nurses, with social workers, with psychologists that were working on cases together. So they've implemented Secure Mail to involve the entire circle of care, because they can invite anyone, including patients, including caregivers who need to be informed about what's going on. And e-consults, that sort of thing can be done as well by inviting any clinic. Beyond just secure messaging, we do have appointment reminders, which are customizable, completely secure, so you can include detailed information about an appointment, what to expect, forms, questionnaires in advance, all that kind of stuff can be pre-configured by as many different appointment types as you want. So it's very fast and saves a lot of time. Now I want to talk a little bit about BrightSquid panel messaging. So panel messaging is a bulk messaging service where you can deliver one message to as many patients as you need to receive it. So clinics use that for screening purposes. If we've got a cohort of patients that we want to get back into the clinic, or that we want to get more diagnostic information about, or we want a survey answered or a questionnaire, people who haven't been in for a little while maybe, or we just want to send out a notification to patients about changes or updates to the clinic in terms of operation hours, holiday hours, anything to do with changes in clinicians or services offered. So we can track those messages, one click of the send button, and we can see who opened it, who clicked on it, who didn't do those things, anybody we might need to resend that out to, that sort of thing. And clinics do this a lot of times in chunks. So they might have 200 patients they want to address and get back in, or get more information from in a survey or a questionnaire, and they can send it to 25 a week, perhaps. And that right now, one message a month is included, up to 500 patients. And then additionally, I think, like I said before, it's about $5 for every additional 500 email messages sent out to patients. So compare that to sending out mail or trying to do a phone campaign, and it really makes a whole lot of sense. We've talked to clinics who have gone through this process and said it would have taken months and months and months or years to have the same impact on patient access and patient outcomes that they have just using panel messaging. Just to talk quickly about how it works, secure mail versus email. So people say, well, isn't just email, or why can't I use email? And we all know that we can't use email. We don't always know why. And here's a quick illustration. You can see that secure mail, all of our information is contained within our servers. It's cloud-based, it's maintained within Canada, it's the highest levels of security. Our connection to that is encrypted. When you send someone a message with an attachment, you're actually just uploading to our servers and assigning access to that person. You're not sending it across the open internet. And down below, you can see that once an email message leaves your computer and your internal email server, it goes across the internet, and there's no way to know where it goes. And what happens on the internet is the internet was not built to keep information safe and private and secure. The internet and email was built to just send information to people so they could get it quickly. What happens then is hackers, cyber criminals pay attention to those servers. They might take the information. But beyond that, if the information travels to a different country, which is likely, even if I send an email to someone in the same city or province, that message is probably going to go to the US, maybe other places, and will be subject to the laws of that country, which probably don't align with the laws around privacy in your jurisdiction. So with SecureMail, we don't have spam, we don't have people trying to sell you things, we don't have viruses like ransomware coming in because we screen for all of that stuff, whereas regular email providers don't do that. We talked a little bit about this, seen increased clinic capacity from around 10 as much as 50%. So less effort and time spent per appointment, so you can have more appointments or do other things. Leads to greater impact on patient outcomes. So that helps with satisfaction across the board for patients, for staff, for clinicians as well. It's used often for patient recall. So chronic care patients, your labs panel, if you haven't seen them in a while, hey, Jeff, it's time to come in for that physical. Or screening maneuvers, right? We know that by 2030, I think the expectation is that there's going to be an extra 20 to 30,000 terminal cancer patients in Canada because of lapsed screening over the COVID pandemic. So this helps us get back on track with things. We can screen large groups of patients for different conditions and identify those patients that really do need to be seen and treated. So we've seen clinics do that in lots of different ways: demographic targeting, condition targeting, results-based stuff as well. All of this kind of comes together to support improved physician satisfaction. I talked about clinic effectiveness as a tool for physician satisfaction. That actually does reduce burnout if things are working well. We don't have to worry about staff leaving next week. We remove barriers to quality. We help patients have access. They send a message or the question in the evening as it occurs to them. They don't have to wait and hope that you answer your phone or able to answer your phone, or that they don't have to wait on hold longer than their break at work is, and then they have to hang up and try and find time to call again later. That leads to lower satisfaction for patients, which then in turn comes back to the physician, and I'm not getting my job done. I'm not having the impact on my community that I went to school to be able to provide. And the collaboration tools. So when we talk to physicians who are burnt out and retire early, we read articles about physicians who say, I just can't do it. A lot of times, part of what that comes back to is that I didn't have access to the supports I needed. I took on too much myself because I didn't have somewhere to send patients for other expert advice. So SecureMail is that connected healthcare community. There are in Canada close to 15 or 18,000 healthcare professionals maybe now, all kinds of different specialties that you can reach out to and say, hey, I'd like some advice on this, or can you see my patient? Just a couple of quick words from clinic managers on what impact SecureMail does in terms of clinic operations. So we use it in many ways: reminders, forms, requisitions, all that kind of stuff. It's quick and easy. When we compare SecureMail to fax and mail, staff and clinicians rate SecureMail as the fastest way to communicate, including fax, mail, and phone, because with phone, you don't always know if people answer. With SecureMail, you can actually look and see that they did read a message. We see less time spent resending or having to manually fax. We see less time scanning. It's fast, and there's a record of what was sent. So if you've got a team working at the front office and you want to know if a message was sent, there is always a record of it in SecureMail if it was sent that way, and the thread is manageable by anybody who has access. So you can work the inbox as a team, just like the phones are done, or just like the faxing is done. It's not about one person. Everybody can get involved and help support those communications. And like I said, with read receipts, you can see when a message was read. So if a patient says, I didn't get your message, sorry, that's why I didn't show up, you can say, well, actually, you did read it yesterday at 2:37. And if a message by chance goes to the wrong person, you can always recall that. So you can pull it back and say, this wasn't for you. And you can actually look and see if a message was read first, and then you'll be able to identify if there's any sort of investigation that needs to be done, looking into risk of harm from a privacy breach perspective. If it wasn't read, you can recall it and everything's fine. You don't have to worry about it. Whereas something like email or fax or mail, if it's sent to the wrong place, there's a whole lot of steps that you have to go through to try and mitigate that. So with that, we'll move on to discussion. And I know we do have some questions that have popped up here I mean, Heather and Lauren, if you want to come back on here, I think a lot of them are for you.
All right, fire away.
Okay. I guess kind of generally looking at operations optimization, and this is a question we do get, how does clinic operations impact headcount? Is it a reduction technique, or how does that fit in?
Well, it definitely can be. When clinics are inefficient, they tend to hire additional staff to address workloads, right? So although this, it seems like a good solution to just throw extra staff at it, if the clinic hasn't optimized their current workflow, it's like a band-aid solution and you're still efficient. Those efficiencies are still present. So going through the exercise of optimizing workflow allows clinics to find those redundancies and eliminate the outdated workflow and implement new technology to create those efficiencies. So this is the first step rather than throwing more FTEs at the problem.
And we've all talked about this, that reallocation, higher value tasks assigned to people rather than the low value repetitive work.
Absolutely.
The next question we have here is, how do you address the idea that the trouble of going through a change in operational process isn't worth it? How do we get to a result that's meaningful and additive, so we're not burning people out with extra work trying to make the change happen?
For sure, for sure. So as a black belt in lean methodology, I struggle with understanding people that think that I don't want to waste time working on changing a process, but in reality, all processes can be improved upon. And they do need to be addressed because technology is implemented and that changes things. So we don't want to throw a piece of technology at a solution, but not change the steps that we're currently doing. And it depends on the situation. Sometimes these operational changes require a lot of input. And the hardest part is really getting buy-in from the staff and physicians because it involves so much of a commitment of time and energy. And the project leader really needs to provide some evidence as to why the operational change will benefit the clinic to start on the venture. Clinics also have to consider that technology advancements are coming fast and furious and in a good way. So why not capitalize on those improvements? To be a lean and mean clinic with the objective of providing quality and timely patient care, we have to make those changes. Otherwise, you're going to continue with the complaints from patients and staff leaving, et cetera, right?
Definitely. And one of the things that we see as really key is working with somebody who can be objective. A lot of times we get stuck on the way we've always done it. And one key example there is we had one clinic who implemented secure mail, and one of our staff, actually someone on our team, was a patient at that clinic, and he was there and he said, "Hey, can I just come back and see how you're using secure mail?" And they said, "Sure." And he watched the staff person open up secure mail, download an attachment, print the attachment, go over to the printer, scan that paper document back to the same computer, and then go in and move it from the file that got scanned into the EMR. Sometimes we need a little bit extra help looking at a process because we're so stuck on, well, I used to have to scan faxes in, so now I have to scan secure mail messages in, when I could have just saved that downloaded file directly to the record that I wanted it to be in. So sometimes it does take a little bit of outside consultation, coming in and saying, here's how we can help and here's how you could and should do things. And it often helps to look at how other clinics are operating. If you look here on the screen, clinic optimization tips, we actually run a user group once a month. There's recordings in there from actual experiences that clinics have gone through to find a more efficient and effective way of doing things.
Yeah, and I just want to add to that, like oftentimes the clinics that we go into, staff are on autopilot. They're just trying to keep their heads above water half the time, right? So they're not in a position to sit there and think to themselves on a routine daily basis, should I be doing this? Why are we doing this? They just don't have time to ask those questions. And that's, where we can help with that objective opinion and really identify and ask those tough questions. We do need to have those changes to improve efficiencies.
The next question here is, what if patients don't want to change with us?
Yeah, this is a very tough one. It's inevitable. You're going to have patients that really don't want to change. They're quite comfortable with what's going on, and that's actually true of physicians and staff as well, as I mentioned earlier. Like for example, I'm sure none of us really wanted to start to check our own baggage at the airport, but we eventually get past it, and you're never going to satisfy everybody. And clinics have to consider, will it satisfy the operational need as well as the mass majority of patients? And ultimately, is it helping with the patient throughput? I mean, that's right. Is that not our objective, is to be able to see more patients to help with the care of patients in our community? So, that's where I struggle with this type of question. But some of this helpful techniques that you can use before implementing a big change is that clinics could also consider strategies to clearly communicate that change. So giving them enough forewarning about what it means to them, what it will look like, why you're doing it is very important as well, so that they understand the why behind that change. And if you get, again, the patient buy-in, then the bulk of them will understand that.
We also know that medical clinics have a lot of authority with patients, and you can say, this is how we operate now. When we talk to clinics who are implementing secure mail with patients, sometimes patients do say, I don't want to use this, just use my regular email. We can't send regular email, and that's a conversation to have. But some clinics, the policy is, I can send it to you through secure mail, or you can come pick it up. Patients aren't that stubborn all the time where they're going to go through the inconvenience of driving across town and taking extra time to go pick something up. And then once they do try the change, they often realize the fears they had were a little bit unfounded. Okay, here's a question, I think probably for Heather. How do we know if a new process or software protects patient privacy?
Yeah, that's a great question. And there's probably a few different layers to that answer. So each kind of third-party vendor, I'm sure like BrightSquid has their own privacy and security policies in place for their unique products and services. So first, I would recommend that clients always engage directly with the third-party vendor to ensure that the privacy and security standards are there and are for healthcare. So being in reference to PHIPA, the Personal Health Information Protection Act for Ontario, that's where Ontario develops their privacy legislation. So healthcare products need to meet PHIPA standards. In many cases with the Privacy Commissioner of Ontario, the critical question is often whether the organization has taken reasonable steps to protect the privacy and security of records in its custody control. So if it comes to a legal case, they're going to make a point to have the clinic demonstrate all the steps that they've went through to try and mitigate or reduce the risk of something happening. Ontario Health has also set some provincial standards for many digital health tools. There's now a verification process for third-party companies to undergo in order to be recognized as a verified virtual solution in Ontario. So again, we would recommend that clinics try to choose digital tools that have already been vetted by Ontario Health. And kind of last, clinics need to make sure they too have their own privacy policies in place for their organization, and ensure that staff understand the terms and use of these products, the expectations from the clinic level with respect to privacy for using these digital health products and services. Yes, there's a lot of thought that needs to go into implementing new technology. And like Marie has indicated, it's good to have a working group and some thought and buy-in, and communicate with your patients about why we're doing this and what that looks like.
BRDA clinics are required to submit their own privacy impact assessment, and any vendors that they work with will have to sign an information managers agreement that basically says the vendor is also subject to the laws to protect patient privacy. In Ontario, it's a little bit different, where the vendors are required to complete a privacy impact assessment. And then clinics have to be able to prove that, yes, this vendor I'm using has gone through the proper processes. That process will likely change. It seems, based on some of the federal legislations coming through, different provincial legislations will probably start to shift more to putting that burden on the individual business, and so the individual clinic that will have to do all of that analysis themselves.
Next question here. How do we know which processes to optimize?
So I'm sure every clinic on this call knows what their pain points are. I'm sure they identify on a daily basis what stumbling pieces they have. So the easy wins are the best starting point, the ones that get the team motivated to see, okay, if we address this issue and everybody involved in that change process sees the benefits, then it's easier to go to like the next step. The best to start with are those easy wins. And the ones that we should optimize are the ones that are clearly taking a lot to go back and forth. It doesn't flow well. It doesn't go from point A to point C clearly, and there's questions around it, or patients are confused, or there's major delays or complaints by patients. Those are the issues that you should definitely address.
Yeah, I think that's great. From us specifically working with clinics, when clinics say, what do I do with secure mail? The first thing we say is stop mailing. It's expensive, it takes time, it slows down communication. And so let's just stop printing stuff and putting it in envelopes and send it digitally.
Oh, here's a question for Lauren. I work in a FHO and my access bonus is chronically low or even in the negative. Can you help us improve this?
That's a good question. I like that. A lot of family health organizations and family health networks have a hard time managing to see positive dollar amounts in their access bonuses. When a rostered patient uses a walk-in clinic, the charges that the walk-in clinic physician bills to are then recouped by the ministry from the FIN or FO physician's access bonus amount. And this is called outside use. So the more patients are seen by other general practitioners, the higher the charges are. So if you put a process in place to monitor patient outside use levels, the ministry does provide an outside use report every month. You can provide education to those frequent flyer patients, or you could consider derostering them, so ending their enrollment with you, but you can still keep them on as a patient and just see them as fee-for-service. There is like a balancing game that you need to play where you weigh the pros and cons of keeping them if their monthly capitation rate is high, or derostering them because their outside use charges then outweigh the capitation. And then you also need to consider your hard cap amounts for your fee-for-service billable amounts. But yeah, I could provide you with tips and information that can help you manage this situation and hopefully see you start getting those positive dollar amount results.
Well, I think we'll do one more question here, and anything that we didn't get to, we'll try to answer more directly, sending out responses to those.
This will be for Heather, I guess. So can you address some of the programs in Ontario? So looking at EMRs, but also lab information system stuff.
Yeah, so Ontario has some provincially funded tools that are available to GPs and specialists, nurse practitioners, et cetera. We do have kind of like a deployment agency who manages most of the enrollment for these tools and services, and that's Ontario MD. Each EMR vendor offers a unique offering in terms of which products and services do effectively integrate with their EMR. So that means there are a number of products and services available, but not necessarily every single EMR vendor is going to offer each of those products and services. Whereas the bigger vendors with the bigger market share in Ontario do offer some products such as HRM, which is Health Report Manager, which is bringing information in electronically from hospital-based systems and some of the smaller private diagnostic labs and other sending facilities. And then we have OLIS, which has been around for a long time. And every clinic, basically, in my opinion, should be using OLIS, which is the Ontario Laboratory Information System. So that hooks up to Ontario's lab information system so that you can get lab results right into your EMR. So that's a passive system where you have to query OLIS to bring data into your EMR. Whereas HRM, Health Report Manager, is passively sending information into your EMR if you're the copy to or ordering physician. And then we have some newer products that we're hearing about coming down the pipes that are integrating with EMRs as well. So things like Digital Health Drug Repository, We are also seeing eConsult, which was previously a web-based platform, get some integration with some of the major players in terms of EMR vendors. And then there's also, private connections that you can be linked up with through your EMR, through some of the bigger labs that are private. So like Life Labs or Gamma Dynacare, they have their own separate but direct connections to EMRs. So for the third-party vendors, you need to reach out directly to them. But for the provincial products and services, we encourage clinics to reach out directly to Ontario MD to ensure that they're up to date with all the current provincial offerings.
Yeah, I know some of the clinics we work with in Ontario get a lot of value from those programs. So if you're not on them, certainly look into it.
Low-hanging fruit, right? They're there, they're free, and they're meant to make your life easier.
Well, that takes us to the time. Thank you so much for your input and insight today. It's for the team from Systemic, and thank you everybody for tuning in. Any final words before we sign off?
No, just thank you for the opportunity to help clinics be the best they can be.
Awesome, great. Well, thank you so much for your help. Have a great day, everyone.